Hi, I'm Dave Clark and I'm working with the Kingsbridge Dementia Friendly community to find out more about dementia, what businesses can do to be more dementia friendly, how we can all access information and support, and how we can ensure that the younger generation are also included in the picture. In this podcast, I'm talking with John about his and his wife's experiences as she goes about her life, how businesses, hospitals, schools and libraries, how everyone can make just a few small changes that can make a massive difference to people who have dementia.
I had seen cases of dementia before. My mother-in-law had it, for example, and so perhaps it was no surprise when my wife developed it. And indeed I had a mother who may or may not have had dementia. It wasn't quite decided. So really, yeah, I've got quite a bit of experience of it now, and in my own family circumstances, my wife has had it for 11 years now, pretty well.
Let's start off by talking about a good example. We were talking about Derriford Hospital.
Hello, can I help?
Level 7.
What are you looking for?
We're looking for... It's not got his people.
It used to be if I took my wife for an outpatient's appointment, I was not invited in with her, and in fact patients went off to see the consultants through one door and then were ferried out the back and you never saw them again.
Right.
Now that's an absolute disaster with someone with dementia. And now they've gone through dementia awareness training. That doesn't happen. I get invited in, which makes things very different. It's far more friendly for my wife, and it means she doesn't disappear off the bat. I can lead her out where I know. And just simple things like, because of the medicine, she needs to go to the loo fairly often. And as soon as I said to one passing nurse, can you tell me where the loos were? My wife has dementia. She was, let me take her. And she accompanied her to the ladies, saw her in, saw her out, brought her back to me. Big, big difference like once they'd had the dementia friendly training.
So, with all the talk about Derriford, I thought it would be a good idea to go along. So, here I am in the echoey stairwell going to speak with Karen, who's going to tell us all about her work making the wards dementia friendly and the staff dementia aware.
My name is Karen. I'm a consultant nurse for older people. Certainly people with dementia will come with a range of health issues. They might come for planned investigation, a planned outpatients meeting. They might come for planned surgery. They come with their dementia, usually not because of their dementia. So it's important that we have services that understand people's needs of those who have dementia and their carers across all of our service lines. We have a leaflet called Getting to Know You, so our staff will know if they know they've got somebody who has dementia, we'll flag them so that everybody who's looking after that person knows that person has dementia. Enabling carers to stay with people has been really helpful to both the person with dementia and their carer. And in an acute hospital, the biggest thing we need to do is reduce the distress, help them orientate, because it's frightening. It's frightening for anybody. Yeah. It's non-stop, it's 24 hours. So for instance, having a quiet space like we're in the busyness of an acute hospital is imperative. It's often seemingly a little thing, but it makes a big difference.
You attend a talk put on by the Alzheimer's Society, and once you've been through that and absorbed the points that are made, you're awarded a badge, which is people can then recognise you're wearing. So if I go to the hospital and see a member of staff wearing that badge, I know that they will respond in a positive way. The swimming pools, sports centres, cinemas, bingo halls, places that have loos, if the staff realise that people with dementia may need to go more often. For example, let's take the cinema. If I stay in the seat and my wife goes off to the loo, she's not going to find her way back. If we both go off to the loo and get back, we'll probably find the seats have gone.
Yes.
So it's things like that which I think makes a big difference. And it is a big business bonus for them because people will go more often there. And in a population like Kingsbridge, there are a significant number of people who have Alzheimer's and would just like an evening out at the cinema. And maybe they could give us reserved signs which we can leave on the seats when we go to the loo. That's just a first thought. I'm sure they'll come up with something a lot better than that.
But even, I think, perhaps even keeping the lights on at a low level, just...
Well, I've certainly known cinemas that do that for autistic people, and it makes a big difference. And I think a lot of the rules which apply could be used in helping people with dementia, yes. I think that's a good one that you've introduced, yes. Right.
The experience of medical establishments, I'm thinking of the pharmacy, they may be lacking in the way that they're dealing with this sometimes.
There are simple things. I mean, I think they can be a little dismissive at times. They think, oh, she's got dementia, because they know that from what they're prescribing, and she doesn't know what she's talking about. But in fact, when they had given her some wrong tablets because of changeover, it wasn't their fault. It's just that the tablets had changed, and in the interim a prescription had gone through, and my wife knew that they were the wrong ones and was saying they were the wrong ones, and they just wouldn't believe her. I had to go back and say, look, she does know what she's talking about. The doctor has changed the prescription and these are not right now. So don't be dismissive. And you've prompted me with another simple thing. I'm not saying it applies to any pharmacy. I note it may apply to other shops. Some forms of dementia, the people do not like stepping on black mats at the entrance to the place. It appears to them as a hole, and so it's quite a frightening experience to try and walk on what appears as a hole. Right. So that's such a simple thing, which I'm sure we could find several examples if we went up and down the high street, of where there are black entrance mats. Possibly changing to a better colour would make a world of difference to some people. So
that's a really good example of something that's very, very common and very simple.
Yeah, and it's a clear business winner. You know, if your customers are not frightened of coming into the shop, they're going to come.
How does this sort of tap into the work of Kingsbridge Dementia Friendly community?
Well, because we tie up with the Alzheimer's Society, we can help organise events. Some of our members can present the approved courses. So it's not a problem. We can fit in with breakfast groups that meet, business groups that meet, whatever the societies are, we can give talks. You want your customers to come in on a regular basis and have a pleasant experience. Now, I do think that without knowing just a few tips, you're not going to see what can be applied to your business to make things better for dementia. The Dementia Friendly course triggers ideas, and I think that's it. You awaken to the idea that just a simple thing, like we've talked about, gives you an opportunity to make your business dementia friendly.
You've been listening to Dementia Lives, and my thanks go to John for speaking to us. Being dementia friendly has never been easier, and if you'd like to find out more, please just search Kingsbridge Dementia Friendly Community. It's the small things that make a big difference. This has been a How production. Thanks for listening. Please share and subscribe.